6 million American families will face fines for not having health insurance. Coverage is now required under the Affordable Care Act, or Obamacare, rolled out a year ago. But many prefer paying the penalty rather than higher health insurance fees. CCTV's Jim Spellman has more.
For the first time, Americans are facing fines for not having health insurance. The penalties are now kicking in based on last year's coverage. Stan Dorn is a healthcare analyst at the nonpartisan Urban Institute.
$95 or 1% of income, whichever is greater. It gradually increases till in 2016 it's $695 or 2.5% of income.
It's part of the ACA, the Affordable Care Act, also known as Obamacare. The fines are meant to create an incentive for individuals to get covered and to help offset the costs of new regulations prohibiting companies from denying coverage to people with pre-existing conditions.
If you say an insurance company can't discriminate against unhealthy people, and then you say there's no penalty to remaining without insurance, the incentive you create is don't sign up for insurance till you get sick. And that blows up the insurance system.
Dorn says overall, Obamacare is making great strides toward universal coverage.
Altogether, we're looking at more than a 1/3 reduction in the percentage of uninsured residents in the United States just over the past year or so, which is extraordinary.
But for some people like Julie Yoder, a 42-year-old small business owner in Washington, D.C., Obamacare has been a major disappointment. Before the ACA became law, she paid about $170 a month for health insurance and says she was reasonably happy with her policy. She supported Obamacare partly because of this promise.
If you like your plan and your doctor, you can keep them. The only changes that you'll see are lower costs and better health care.
Despite President Obama's claim, her policy didn't meet ACA requirements and was eliminated. So she signed up for an Obamacare plan and her rates went up. After a $28 a month subsidy, she was forced to pay about $300 a month and found that procedures like follow-up mammograms weren't covered at all.
Have you been surprised to receive these explanations of benefits telling you they're not going to pay for things that you had expected to be covered?
Yeah. I mean, I get anxiety every time I see it come in the mail.
So the threat of a small fine hasn't been enough to stop her from dropping her Obamacare policy and shopping for a new one.
I'm much better off just paying the penalty than paying $300 a month for nothing.
According to the Urban Institute, it's too early to tell if Obamacare will lead to better healthcare outcomes long term, but Julie Yoder says for her, Obamacare is a bust.
Bottom line, has the ACA made you more healthy or less healthy?
Less healthy.
Jim Spellman, CCTV, Washington.